unravel all these different threads, give you the full picture based on our sources, naturally, and then we'll let you decide what resonates.
And what's compelling is exactly that tension you mentioned. We're looking at something where, for many people, their own experience or what practitioners see is incredibly powerful.
Where they feel it works.
But it just struggles to fit neatly into, let's say, established scientific boxes.
Makes sense.
So yeah, our goal isn't to endorse it or dismiss it. It's about understanding, critically examining the information from the source material, empowering you, the listener, to form your own informed perspective.
That's a really vital distinction to make right up front. Okay, so with that framework set, let's dig in to really get this. Where did biomagnetism, or I guess more specifically, biomagnetic therapy, where did it actually start? Who was behind it?
Well, the person credited with founding biomagnetic therapy, often just called biomagnetism, is Dr. Isaac Goiz Duran. He was a physician in Mexico.
Okay.
And his key discovery, it came back in 1988. Apparently, he was working with a patient who had been diagnosed with HIV.
Right.
And it seems like it was a mix of things: intuition, very careful observations, some experimentation. He stumbled onto what he called the biomagnetic pair.
The biomagnetic pair, what does that involve?
The basic concept was placing magnets, specifically of opposite polarity, on two very specific points on the body.
Ah, okay.
And he observed, reportedly, quite rapid improvements in his patient's condition after doing this.
Interesting. And what was his thinking behind why this might work? What was the theory?
Well, Dr. Goz's theory really dives into how our biology functions. He ended up mapping hundreds of these pairs all over the body.
Hundreds? Wow.
Yeah, his core idea was that pH imbalances inside the body, acid-base levels being off, create environments where pathogens can thrive. Viruses, bacteria, fungi, parasites, that sort of thing.
Okay, so the internal environment matters.
Exactly. He proposed that by using these magnets, you could actually influence hydrogen ions.
Which determine pH.
Precisely. Those tiny particles are key for the body's acid-base balance. So his theory was this magnetic influence could kind of create a biological reset.
A reset.
Gently nudging the body's pH back towards an optimal state. And by doing that, neutralizing the imbalances and supporting the body's own natural healing abilities.
That's quite a theory. It paints a compelling picture, especially linking it back to that initial reported success. So what kind of response has this approach actually seen out in the world? From clients, from practitioners?
Well, what really stands out is just the sheer volume of reports. I mean, we're talking thousands of people worldwide.
Thousands.
Yeah, claiming they experienced significant improvements. And often, this is after they felt like everything else had failed them.
So people finding relief when other avenues didn't work.
Exactly. There's an organization, the Foundation for Alternative and Integrative Medicine, ALEM. They published an article that specifically talks about the overwhelming nature of these testimonials.
Wow.
So it's not just, a few scattered stories. It seems to be a pretty significant, consistent pattern of people reporting relief.
And practitioners, they aren't just going by what people say they feel, are they? I read they describe something quite specific they observed during sessions.
That's right, precisely. Practitioners talk about observing this distinct physical phenomenon. They call it the leg length reflex.
Leg length reflex, how does that work?
So they'll place a magnet on a point they identify, often a pain point, and then they observe one of the client's legs. Apparently, often the right one seems to shorten or lengthen slightly.
Really? Visibly?
Visibly, yes. And then when they place the opposite polarity magnet on a specific corresponding point somewhere else on the body.
The other part of the pair.
Exactly, the other part of the pair, the legs visibly evened out again.
Huh.
So the point is, they feel this isn't guesswork. Practitioners are observing what they see as clear, objective physical responses.
And these are often linked to the client feeling better.
Often linked to clients reporting immediate relief, yeah. It suggests to them that some kind of direct physiological interaction is actually happening.
Okay, so you have this compelling picture.
Yeah.
The theory, the anecdotal success stories, these practitioner observations, like the leg length thing. But what's been the reaction from, mainstream medicine, the scientific community?
Yeah, despite all that, the volume of anecdotal evidence, mainstream medicine, and the wider scientific community have, largely dismissed biomagnetism.
Dismissed it.
Yeah.
Why? What are the main criticisms?
The key criticisms usually come down to a couple of things. First, a lack of rigorous, peer-reviewed clinical studies. The large-scale trials that are the gold standard.
Right, the kind of proof they look for.
Exactly. And second, the absence of measurable mechanisms that fit neatly within our currently accepted scientific models. how does it work in a way science can easily explain and measure right now?
So we're really talking about a significant gap in what's considered acceptable proof.
Absolutely. And you have some prominent critics who are quite vocal, like Harriet Hall, for instance.
What does she say?
She's called biomagnetism, and I'm quoting here, an errant pseudo-scientific fantasy. Pretty strong words.
Very strong.
And she explicitly states there's no evidence that magnets can influence biological processes in the body.
No evidence at all.
That's the assertion. And this kind of dismissal, it obviously has a real impact on practitioners.
I can imagine.
I mean, here they are, often trying to support people who feel like conventional medicine hasn't helped, or maybe has even given up on them, folks with chronic infections, weird unexplained symptoms, maybe antibiotic-resistant conditions.
They get labeled.
They often get labeled snake oil salesmen or pseudoscientists. It really raises an important question, doesn't it? What counts as enough evidence? And where should the burden of proof lie when something appears to be helping people safely?
Okay, so that's the mainstream view. No evidence magnets influence biology.
Yeah.
But what if there was evidence? And maybe from a source people aren't expecting.
Now we get to the twist.
Let's talk about NASA. Remember that criticism? No evidence magnets influence biological processes.
Yeah, I remember.
Well, get this. NASA has actually studied the biological effects of static magnetic fields.
NASA has.
Way back in 1970, a NASA researcher named Charles C. Conley published findings. And what he found was that exposure to static magnetic fields, even fields weaker than Earth's own magnetic field, could actually alter cell growth, metabolism, and even lifespan in various species.
Weaker than Earth's field. Wow. Altering cell growth and lifespan?
Yes. And this isn't some fringe thing. This is published research from NASA.
Okay. That's genuinely surprising, especially given the mainstream dismissal.
Right.
And what's really striking there is the direct parallel you can draw. NASA reported finding, what did you say? Shifts in aging, growth rates, and cell behavior under low-level static magnetic exposure.
Exactly.
Those are precisely the kinds of physiological shifts that biomagnetism practitioners believe they are working with when they apply their magnets.
It sounds like a direct overlap.
It really does. So NASA's own findings from decades ago, they strongly suggest that magnetic fields do, in fact, have a biological impact.
Which directly contradicts that assertion that there's no evidence for such effects.
It certainly seems to. It makes that flat dismissal much harder to sustain logically.
It really does seem like a significant contradiction. Okay, so if NASA's own research points to clear biological effects from magnetic fields, and we have all this anecdotal evidence, these practitioner observations of positive results, then why? Why the consistent, almost aggressive dismissal from the mainstream?
That's the million-dollar question, isn't it?
Our source material brings up a pretty controversial hypothesis here. It suggests looking at the potential lack of profit in magnets.
The economic angle. And when you connect that to the bigger picture, the economics of healthcare, it does become a really compelling point to consider.
How so?
Think about it. Magnets are fundamentally pretty cheap. They're accessible. And crucially, once you buy them, there's no recurring revenue stream.
Right, unlike a drug you take every day or a therapy you need regularly.
Exactly. In a healthcare system where, let's be honest, billions are made from ongoing treatments, pharmaceuticals, complex procedures, long-term management, a low-cost, low-tech option like biomagnetism might just be too disruptive. It doesn't fit the economic model that thrives on continuous consumption.
So the argument is, it's dismissed partly because there's no money in it.
That's the hypothesis put forward in the source, yes, that something so potentially safe, affordable, and non-invasive, as the source describes it, should be studied more seriously, especially, and this is key, when foundational research from an institution like NASA points towards its potential biological plausibility.
It definitely highlights a critical perspective on what gets researched and why. You know, how funding flows, what questions get asked, and which ones maybe get ignored.
It forces you to think about the non-scientific factors that might influence scientific attention.
Okay, so let's try to recap this journey we've taken in this deep dive. We started with the origins of biomagnetism, Dr. Goes, back in '88.
Right, the biomagnetic pairs.
Then we look at the really compelling anecdotal evidence, the sheer volume of it, and those specific practitioner observations like the leg length reflex.
Things people are actually seeing and reporting consistently.
But then we hit the wall of that strong mainstream dismissal. Lack of studies. Doesn't fit the model.
The pseudoscientific fantasy critique.
Yeah. And then came that surprising NASA finding. Clear evidence from 1970 that static magnetic fields do have biological impacts.
Which seems to directly undercut the main criticism.
Exactly. So the bottom line seems to be maybe biomagnetism deserves a proper seat at the research table. Not, blind acceptance, but fair, open-minded inquiry.
I think that's a fair summary. With NASA's own studies pointing towards magnetic effects on living systems and just so many practitioners and clients reporting positive shifts, maybe it is time to move beyond just ridicule and actually start asking the right questions.
Yeah.
But it's also really crucial to remember, and the source makes this point too, no one can promise a cure for anything, right? Illness is just incredibly complex.
So many factors involved.
Way too many. You've got genetics, your environment, maybe past trauma, lifestyle choices, and probably a whole bunch of unknown variables we don't even understand yet. So balance is needed.
Absolutely. Keep that complexity in mind.
But maybe we can leave you, the listener, with this thought to mull over. Building on what the source suggests, what really motivates scientific investigation, and maybe, just as importantly, what motivates scientific dismissal, especially in health. How much do economic incentives shape what we even study or what we accept as possible, particularly when it comes to therapies that are low-cost, non-invasive, maybe don't generate ongoing profits?
And what does it truly mean to be evidence-based when foundational research, like that NASA study, seems to exist but gets seemingly ignored in certain contexts?
Yeah. How do we value different kinds of information? What gets explored, what gets sidelined in our collective pursuit of well-being? Something to think about.